Mr. Richards is a 45-year-old husband, father, and respected high school coach who has just died from pulmonary embolus complicating overwhelming COVID-19 pneumonia in the intensive care unit. You are the physician on call, a member of the team treating him. Tonight, you are the one who must inform his wife of his unexpected death, but you're being summoned to the emergency department and to answer many waiting phone calls. Sharing difficult medical news like this is one of the hardest things that we must do as doctors. In this video, I want to introduce you to an excellent tool for having these conversations, one that I have used repeatedly over the 30 years of medical practice that I have. Hi, I'm Dr. Jeff Crane. In 2000 and again 2005, publications were in the oncology literature by two doctors who helped shape and frame conversations about a compassionate way to deliver bad news to our patients. Originally designed for cancer diagnoses, today we've adapted widely this protocol for all types of bad news situations. It's called SPIKES, S-P-I-K-E-S, an acronym that has a step for each of the letters. Let's have a look. So the SPIKES protocol has four main objectives. One is to gather information about what the patient really understands. Two is to deliver the bad news. Three is to support the patient in the process of giving them the bad news. And four is to collaborate and develop partnership with them to move forward out of this bad situation. The first letter of SPIKES is S. S stands for setting. It's important that we create a proper setting for the dialogue with the patient. You don't do it standing in the hallway. You should move to a private area. You should turn off your mobile phone. You should tell your secretary to not interrupt, and please no one knock on the door. You should make sure that you sit down and reach an eye level with the patient so that good communication is going to happen. The second letter of SPIKES is P. P stands for perception. It's very important to understand what the patient perceives about the condition or the illness or the intensive care course of the loved one. We want to know where you're starting from. And you need to ask the patient something like, could you give me an understanding of how you see this problem? Or how do you understand what's happening to your mother? Sometimes patients are in denial. And if they're absolutely out of touch with reality, you need to accept this at that moment. Perhaps involved family members or others who can help. The third letter of SPIKES is I. It's about an invitation. We need to ask our patient if it's okay that we share with them some information. Would they like to know what's happening with their loved one? If they say no to you, you need to accept the fact that they're not ready to hear it. And you perhaps plan this for another time when they're more prepared. The next letter in SPIKES is K, knowledge. We share the actual bad news, the medical facts. It's really important to understand the socio and educational level of the patient. You want to use terms that they can understand. It would be entirely inappropriate to say that Mr. Richards died of a massive pulmonary embolism as a complication of acute respiratory distress syndrome as a complication of SARS-CoV-2 virus infection. Patients will not understand you, you lose them immediately. You need to talk at a level they can understand. You need to give them information that's small and in small chunks so that they can process the bad news step by step. You need to make sure that the patient understands what you say, and it's valuable for you to ask them to repeat back their understanding of what you've just said. Try to give as much good news as you can first. You know, the cancer has not spread to the lymph nodes. That's a really good thing. So you want to try to reassure the patient as you give bad news with as much good news as you possibly can. The fifth letter in SPIKES is E. It stands for emotions or empathy. This is perhaps the most important part of the protocol. You can expect an emotional outpouring from the patient. A burst out of anger or crying or a recoil so that they just can't control what's happening to their emotions. They're overwhelmed by the bad news. You need to give them permission to do this. You need to give them time to process. And sometimes you need to say, it's okay to cry. It must be very difficult for you what's happening right now. I'm here for you. You have all the time that you need. The final letter of spikes is another S. That's where we summarize. It's important to conclude the encounter, to bring closure to this conversation by summarizing the main things that you've told them, validating their emotional response as being okay, and setting a plan for what the next step is. You might want to say something like, I'll give you time to process this with your family, and I'd like to speak with you again this evening or tomorrow morning. Giving a summary and a closure gives the patient closure at this moment and helps them know how to begin the next steps forward. Okay, so let's review. Spikes is a very valuable and useful tool, a protocol of how to have a conversation with a patient about really bad news. Spikes is an acronym. S stands for the setting. We must set the stage to have a good conversation. Remove distractions and prepare the way so that you can communicate very well and clearly. P stands for patient perception. You want to understand where the patient understands the situation, where you're beginning. I is asking for an invitation. You need permission to share this news, and if the patient doesn't want to hear it, you need to wait. K is knowledge. This is where you give the bad news, the medical facts. Keep it simple, talk to them at their level, give it in small chunks. Be as positive as you can. E, explore their emotions. Allow catharsis. Use empathy to help them process. And finally, S is summarize. Give them a recap and a closure on the meeting and help them strategize for where you go next. Thanks for listening. Telling people bad news is one of the hardest things we do in medicine. I hope this has been a useful discussion that will help you grow this part of your medical practice.